What we're trying to do is address a gap in our current system. We recognize that the health system right now has been strained due to a number of factors.
It's being described as healthcare for the future. A new and innovative way to navigate the system was launched yesterday at Sunnybrook Hospital, one of only 2 institutions in Ontario to try such a program. It's a virtual emergency room, and it allows patients with urgent but non-life-threatening health concerns to consult with an emergency room doctor without having to go to the hospital.
What I was noticing during COVID wave 1 was a lot of fear and anxiety, and a lot of patients were delaying seeking care. The emergency department, even at the best of times, can be certainly chaotic and loud and long waits for patients. And so this opportunity came about to be able to provide patients with optimal physical distancing in the department, to be able to save on personal protective equipment, and also to try and improve the time in which we're able to see patients, and also to alleviate some of those fears and anxieties around coming to a hospital during COVID.
The way it works is the patient phones and books an appointment that will be held that same day over Zoom. So far, doctors have been able to see at least 14 patients a day. They might prescribe a cream for a skin rash or be able to advise if someone has an infection or viral illness. Sometimes a patient is told they need to attend a hospital, but even then it helps make the process as efficient as possible. Dr. Hill gave an example of a patient who presented with abdominal pain, but who did not want to come to the hospital.
They were actually concerned and described a fear of coming in and wanted to avoid a visit. And we actually were able, even though we had to send them into the department, we were able to provide that reassurance that they should seek care and that we would be able to help them in a timely manner.
This is a 6-month pilot project that was developed because of COVID-19, but the goal is to show that this is a model that is safe and works towards a more efficient system. Dr. Hill hopes it will become permanent. In the meantime, Sunnybrook Hospital wants to assure people that their emergency department is open and safe. I'm Pam Seatle, City News.